Dr. Debmita Dutta. So congratulations Ananya on taking up this excellent project to create awareness about teen depression. It's definitely a very important thing to do. So you've asked me 3 questions that people are commonly asking in your sessions, and I'm answering them in the next few minutes. So the first question you've asked me is, how is teenage depression different from adult depression? So I think it's a very, very important question, because teenage depression may or may not have the classical signs of adult depression, which is extreme sadness, withdrawal from all social connection of all kinds, and insomnia or inability to sleep. In contrast to these, which are seen in adult depression, in teenage depression, actually you may see an extremely irritable teenager who's always getting angry, always talking back, leaving the company of his old friends and getting into the wrong company and making the wrong kind of friends, and also not studying, doing things which you may think of as fun, such as playing with mobile games or being on the laptop or the computer or the phone or the tablet all the time. So you may think that this is a child who's gone astray, but this is a teenager who may be in depression. So very important question, and this is the answer. Moving on to question number 2, where you've asked me, what should you do if you think your teen is depressed but refuses help? So it's very, very important when this happens for you to reach out for expert help yourself. So reach out to an expert, talk to the expert, explain how your teen was before, what are the changes you've observed over the past few weeks, months, whatever, and how you feel that the expert will definitely ask you questions about what has changed and help you to understand which changes may have actually led to your teenager behaving the way in this depressed manner. And then the next step would be for you to build, once you understand why your teenager is behaving a certain way, build empathy, build compassion, connect with your teenager with empathy and compassion, and listen to the expert. Ask the expert what you can really say to your teenager in that situation to get him or her to come for help. But before that, you need to build a connection of empathy and compassion. Otherwise, your teenager is never going to come out for help. And you must be very sure to convey in all circumstances like this that it is not the teenager that you're trying to fix, but the situation that has caused this. When you focus on the situation, your teenager is sure to be amenable to reach out for help. So moving on to question number 3, what should you do? Whom should you go to? A psychiatrist, a psychologist, or a therapist? So very simply, in terms of professional qualifications, all 3 are qualified to help you with teenage depression. A psychiatrist, of course, is the only one who will be able to actually prescribe medicines for depression, which may be required. But all 3 can give you other tools such as behavioral and other interventional tools which will help you to help your teenager out of depression. How you would choose such a person, actually, I would say should be a two-step process. The first step is for you to look online at various profiles and check out who you think will be the best fit for your child. Then go and meet the therapist or the psychologist or the psychiatrist on your own without your child. And then step 3, come tell your child that I've met this person and I think that this person can help us out. So let's go, let's approach this person. Show your teenager the person's profile, some articles that the person may have written, the professional may have written, some videos that the professional may have created, and build this sort of connection between your teenager and that stranger, that professional whom you're taking your child to understand that he is a complete stranger for your teenager. Build that connection and then take your child. That's the way, I think, allowing a lot of decision making in the process is the best way to choose a professional for teenage depression. So thank you for having me, Ananya. Good luck with your project. Thank you.